As an intensive care doctor, I am in the front line of taking care of patients with COVID-19. I am having shifts, daily shifts and night shifts with these patients with COVID-19. And what we see here, the number of COVID patients is increasing substantially during the past 3 weeks at this hospital. So we expected that in some weeks, we're going to have a huge number of COVID-19 in São Paulo. And as such, probably we will run out of ICU beds in our city. When the disease first arrived in Brazil, it came with the richest people that traveled to Europe or that traveled to the US. The first reported case in Brazil was late February, probably 25th or 26th. But now there are some studies, some suggestions that the virus was already here in Brazil at the carnival time. So it was already spreading, even though it was not diagnosed or recognized at that time. As the disease spread from the center of the city, where the richest people live, to the periphery areas where we have what we call favelas and the poor neighborhoods, and then the disease is probably going to get much worse, because in this scenario, we have a very big Brazilian issue, which is the inequality. So we have a lot of poor people that do not have access to clear water or to sanitation. And sometimes they live in small houses with 1 or 2 rooms and with up to 10 people in these 2 rooms. So it's completely, it's very difficult, almost impossible to do social isolation. I think the numbers of cases in Brazil are very much underestimated. We probably have several times higher than the number of cases that are being diagnosed in Brazil. Because, for instance, if you have a flu-like symptom and you go to the hospital, you are seen by a doctor, and the doctor says, yes, you can have COVID, but we are not testing you because you are a mild case. You can go home, you stay at home. If you get worse, you come to the hospital, we will test you. The other issue regarding why the disease is spreading in Brazil is that for the poorest people, it's very difficult to stay at home, because if they stay at home, they have no money to buy food for them or for their kids.
Saúde, saúde e economia. O povo não pode morrer de fome.
E daí? Lamento. Quer que faça o quê? Eu sou Messias, mas não faço milagre.
All his comments regarding this pandemic are to depreciate the importance of the scenario and to move the economy forward. But the problem is the message that he sends to the Brazilian population. If the president says that we can go out to go to the barber or to the gym, a lot of people will hear him and do this. And this is why we have a big problem with social isolation in Brazil. We can have here a huge number of deaths. We already have close to 12,000 deaths in Brazil so far. It's, of course, we are far from the US or far from Italy and in Spain. But on the other hand, these countries have less inequality regarding wealth than Brazil, and they also have, as a whole, a better healthcare system than our country. So it's possible that in Brazil, the country will be very, very compromised by the virus.